going back to the tool paper that you mentioned, is that when we look at a battery of tests, very few people are meeting all of them. So it, I think, really supports the idea of testing in a multifactorial nature, evaluating different types of measures of knee-related function, patient-reported, psychological readiness, strength, performance, movement, because performance on one doesn't necessarily indicate, adequate performance on another.
With that point, can you talk a little bit about the limitations of a limb symmetry index in general? You've alluded to this a little bit, but why are those important historically, the data behind those, but also just limitations with them that clinicians should be aware of?
Yeah. So this is a really big discussion in ACL reconstruction, rehab, and return to sport decision making right now. I think one study that really highlighted kind of what might happen to the uninvolved limb over time from, early after injury or early after ACL reconstruction until they get, kind of progress throughout rehab toward the time of return to sport or even further, was a study that was published by Liz Wellsant, also in JOSPT a couple years ago. I think the title of that study was like Limb Symmetry Indices Underestimate, uninvolved limb performance or something along these lines. And basically what they did in that study is they had a cohort for which they tested both limbs prior to ACL reconstruction, and again at the time or around the time of return to sport clearance. And so they looked to see if they calculated limb symmetry indices for the involved and the uninvolved limb using the uninvolved value at the time of return to sport, basically kind of characterize what that looked like. And then if they took the uninvolved limb value from back, shortly after their injury, those limb symmetry indices were a lot lower. And way fewer patients met the kind of 90% threshold if the uninvolved limb value was the one that was used shortly after their injury. And so I think that finding was really eye-opening for a lot of people to see what the potential for either due to bilateral kind of neurologic injury effects or detraining, by being out of their sport, or focus on kind of, single limb or injured limb kind of rehab, the effect that might have on the uninvolved limb. So, if you imagine in an ideal world that the uninjured limb performance and strength stays the same and the injured or reconstructed limb kind of over time comes up to meet it, that's the ideal use of a limb symmetry index. Unfortunately, it doesn't seem like that is always the case. So you might have this scenario where, throughout rehab, the involved limb is getting stronger, but the uninvolved limb is maybe coming down to meet it. So you have a symmetrical, patient who has symmetrical strength or performance. But the analogy that's sometimes used is like, riding a bike with two flat tires. So you restore symmetry, but this athlete is not to their pre-injury capacity, whether that be strength or functional performance or whatever it might be. So there have been several studies to kind of show this same thing, that the uninjured limb over time, if not, specifically addressed alongside the involved limb during rehab, might lead to this scenario where we're underestimating the capacity in the involved limb by comparing it to the uninjured limb. And so I think that is the inherent potential concern with just the use of limb symmetry indices. And so I think that supports also evaluating and comparing the function of the involved limb to other reference points. And so that might be comparing their normalized strength or peak torque to some age or sex or sport matched norms, to know, are they where their non-injured peers are that play similar sports and that are of, the same sex and age. Also, if there's an opportunity to test the uninjured limb early in rehab, even if clinicians aren't seeing patients, for prehab or something, like if you're not seeing them between injury and ACL reconstruction, even if you're seeing them shortly thereafter, if there are some measures of the uninjured limb that you can test early on, that might be a good benchmark to come back and compare the injured limb to over time, just as a kind of practical consideration for these patients. Trying to remember where else I was going to go with that, but I think those are the concerns with limb symmetry indices. And if I can make one caveat to say, all that said, we also have a lot of evidence to support that getting people to certain thresholds just based on limb symmetry is important. So I don't think we should throw it out the window. I think we should recognize the limitations in the use of symmetry measures, particularly in cases where there's a decline in uninvolved limb strength or performance, but also know that we have a lot of evidence to support the use of limb symmetry indices, whether that's strength or hop test performance, on outcomes over time. So it's a good discussion. It's important to recognize, but we also shouldn't, on the flip side of the coin, assume that limb symmetry has no effect or no importance either. So
you touched on a follow-up question that I had was, should we also factor in absolute peak values? And you mentioned that perhaps comparing to some age-matched norms or population-matched norms, and then with the results of the current paper here showing that perhaps absolute values are important as well, just another factor to consider. Do we have these norms to compare to yet? Is that something that we're working towards?
So there are some data sets of sport-specific, I know for sure, single leg hop test norms, potentially strength. I have those references somewhere. I can send them to you if you want to, post them somewhere or something. I have to dig in to remember exactly what those are. But yeah, I think that using a decision-making paradigm that incorporates symmetry, incorporates training and evaluating absolute performance as well, whether that's absolute strength, absolute jump performance, like you indicated, Quinn, in this study. Our findings that differentiated these groups were only based on normalized absolute hop performance and no other measure, and not symmetry. And so this, again, like we talk about a little bit in the conclusion of this paper, it may indicate that we need to focus on training bilateral absolute performance and evaluating it and comparing it against some kind of reference value.